Yeah, beautiful. Okay, so now I get to present one that I'm very excited about. And I think there might be a family member on too, which I'm really excited about. So it is my very great pleasure to announce to you all our clinical preceptor of the year, my so beloved Jewel Young. Um, if anyone has ever had the like just pure joy of sharing space with Jewel, I've never met anyone who like makes me feel better just by being around. I miss that we can work together, but I have to say, if you can't hang out with Jewel, email with her because she is one of a few people who can just like deliver her presence through email. It's a joy. And so Jewel, just to give you some background, if you don't work on Thursday or Friday mornings, Jewel is one of our clinical pharmacists who works with us through our partnership we have with UIC. And so every Thursday and Friday morning, she's holding appointments with our patients in Spanish for medication therapy management, diabetes care group, a whole host of usually the most kind of complex appointments. And in addition, she works with pharmacy students to help them get to be half as awesome as her. This year, of course, so Jewel has been doing all of her appointments since COVID via telehealth. And so it's been challenging to figure out how to incorporate students into that. So she's gotten completely creative, which is very second nature to you, Jewel, to think about new ways to engage her students. I miss very much being able to kind of float back into clinic on a Thursday or Friday morning and just like eavesdrop on the way you talk to the students. You have such an amazing balance of setting like very clear and high standards and like not taking crap. But in reward for that, if they hit their mark, their reward is massive in the support that you give, in the learning you provide. I know I've heard you have so many amazing conversations to really push your students to think more broadly about the patient experience, about social determinants, about how they've been alienated from the healthcare system and you need to build trust. Like these are conversations I've heard you have and love the way you're able to convey it. You've used your personal experiences to get the students to connect. I just like your approach to teaching is one, if I were ever to be a teacher, I would try so hard to emulate. So for all of these reasons and more, I want to, with my whole heart, celebrate Jewel. I want you to let us know when you speak which wonderful other Young I'm looking at so we can all celebrate together because this is gorgeous. Jewel, take it away.
So that's my mom, Mabel Young.
Hooray for mom!
We love your daughter. Great work raising your daughter.
Thank you. Thank you.
And my mom is a teacher, so I was raised by a teacher, and everything you said about me, you could have said about her because she was hard as she could be and just as sweet as sugar about it, and she still is. But I definitely have to thank not only everybody at Community Health. So let me just say this. I was a teacher for about 15 years before I became a pharmacist. And when I became a pharmacist and when I was a pharmacy student, one of my goals was to work at Community Health. It's why I selected my residency at Chicago State. And that was the year that Community Health Southside Clinic closed. So honestly, without exaggeration, working at Community Health is a dream come true for me. It's exactly where I wanted to be. And I thought maybe I would be there for a year as a resident, but as long as I don't mess up. Now, Dr. Durley is also on this call. She's my boss. So as long as I stay in good standing with her, I think I can stay in good standing with Community Health. And it's been more than a dream come true because I love going to Community Health. It's one of the most wonderful experiences in the world. I enjoy working with everybody. There's so many wonderful people to admire and to be like. But I have to say, I owe the greatest gratitude this semester actually to my students because it has been hard. And they are so unfailingly optimistic and hopeful and courageous. And on those days when I just think this kid is crazy, I eschew that thought and I think, you know what, be lifted. Be lifted by this young person who has constantly renewed hope and let that drive your work. And so I guess I earned the preceptor of the year because I had the students of the year. And they definitely help me bring to the patients what I want. I always say I wish community health were my clinic, and I'm not kidding. I really do. The kind of people who will listen to you on the phone and then say after the call, I think she needs to talk to social work because she sounded really down. That's something I've never had the doctor do. And we do it all the time, every day. So I'm very proud to be a part of this organization. I'm very happy. And thank you all very much. I miss you a lot. I can't wait to come back. I lost like 10 pounds. So I'm ready to come back to community health and put it all back on. So thank you.
Thank you, Jewel. Mama Young, if you want to say anything on how you, also, I didn't know you were a teacher before this, so this makes like such beautiful sense, how you hone these skills.
Okay, well, I just want to say congratulations to Jewel. And then listening to what you all were saying, it seems like you all were handpicked, okay, for what you're doing, because you are clear-headed and positive and somewhat tired, but you keep pushing through. So just want you to know people out there appreciate the work that you do. They really do. And I don't know what else to say. I was a teacher and I enjoyed teaching for 40 years. So I passed some of that on to Jewel, and it makes me proud that she is a teacher, but it makes me even prouder that she is a pharmacist. So I bring all my problems to her. I get her advice, and she's so patient with me. So I'm praying that, and I know she's patient with everyone else. So thank you so much for letting me do this.
Thank you so much for joining us. This is really, really lovely. I think it was last year or 2 years ago when Otis got his award. I think it was last year, and he was our pharmacy volunteer of the year, and he brought his family with him to the event, and they got to all come and stand up. And so we didn't even lose that in what we did here. This is just beautiful. Thank you for sharing.